Cool. All right. Welcome again to another series of videos as we look at the pharmacology of tetracycline. I'll be working with this outline and introduction slash history, the structure I will classify, mechanism of action resistance, adverse effect, and uses slash therapeutic indications. Now, for tetracycline, a brief introduction tells me that they are usually bacteriostatic. They are usually bacteriostatic. These drugs are usually bacteriostatic at low doses. But when we increase their dose, they become bactericidal. It has a broad spectrum. That is also very necessary. It has a broad spectrum. And this drug also has the ability to chelate trivalent ions and even divalent ions. Trivalent ions of the examples of aluminium 3 plus, iron 3 plus, etc. Divalent like calcium 2 plus, like magnesium 2 plus, etc. And this is going to affect the way they are being deposited in various body organs. So bacteriostatic, broad spectrum, and the chelate trivalent or divalent ions. Now, necessary for the history, it was discovered around the 1940s. They were discovered around the 1940s and have found application all over these years. Structure for tetracycline should have four cyclic ring. Four cyclic ring from the name, tetracycline, A, B, C, D. And then from its science, there are many functional groups attached to it. Now, I'll call them arrow. But the most common of these functional groups, that could be attached could be the ketone groups, or could even be the hydroxyl group. All right. And it is the changing of these that has brought to the discovery of different tetracycline drugs. So either we bring ketone groups or hydroxyl groups, and these automatically would likely change the cause of drug prevalence. Now, how about classification? I have the natural drugs. I will classify them natural and semi-synthetic. Natural and semi-synthetic. So what are you going to see in the natural drugs? A good example is tetracycline itself. So tetracycline itself is an example of a natural drug. And that drug again that happens to be here is oxytetracycline. So add an OH group, an oxygen group, then it becomes oxytetracycline. Also add chlorine group, it becomes chlorotetracycline. Now for semi-synthetic, we have the likes of doxycycline, minocycline, and etc. So these are examples of drugs that we see natural and semi-synthetic. All right. Now, what is the mechanism of action of this drug? How do these drugs act? So let me say something quite necessary. Tetracycline, if you remember how it looks like, this is how the cell looks like. Let's say this is the bacteria cell. This is the bacteria cell. Now, in this bacteria cell, we have a nucleus. This is the nucleus. Now, in this nucleus here, we have protein that like one is in size from mRNA, and in this mRNA, we have some ribosomal unit here called 50S. Then we have a smaller one called 30S. Now, quick thing again, drugs that act on protein synthesis, we remember them with add 30, add 30S, and then cell 50. Cell 50S. A was aminoglycoside, which a video has been dedicated on it. T was tetracycline, which we are discussing now. So tetracycline, you should remember, binds to 30S. C was chloramphenicol. Alright. E was erythromycin. L was linezolid. Linezolid. Then L was lincomycin. So erythromycin is what we are talking. That's also called macrolide. So if you see that video that has been done already, you can be able to appreciate that. So what we are discussing is tetracycline, which is 30S. So tetracycline, now in this 30S, I'm going to divide it into three different subunits like this. We have the A side, we have the T side, we have the D side. Now what this drug does is that, remember, we might have the elongating chain like this. Probably we have something like this. And then it has proteins that are elongating like this. Then a new one is coming here. So what it does is that once it binds to 30S, it will prevent the new tRNA from that reaches the A site from eventually making a bond in mRNA. So what it does is that the new amino acyl tRNA in the A site does not have a firm grip with mRNA. Once it binds to 30S, that integrity between 50 and 30 is never formed. So what happens is that the new tRNA that reaches the arrival site does not make a firm grip with mRNA, and that means that protein synthesis is inhibited summarily. Mechanism of action for tetracycline is that it binds to 30S and will prevent protein synthesis, if you can remember that. Okay, that makes it easier. I'll still dedicate a video separately to discuss all the steps in protein synthesis, and then I'll now have to now summarize all the drugs we have talked about in protein synthesis for our bacteria. So mechanism of action was that it binds to 30S, ribosomal unit, and this is going to prevent protein synthesis. All right. Now, how about resistance? Resistance number one for most of them is that, remember, this drug will need to enter here. Most of these drugs, they need to enter, then they find their way again. So we either inhibit the influx of that drug. When we stop the influx of the drug, it does not reach the site, number one. Or even if the drug has been entered inside, we can pump it out. So we can also increase efflux. All right. Then number three, enzyme inactivation. Enzyme inactivation. Now, enzyme inactivation means we use some enzymes called tetracyclinase. These drugs are going to inhibit that our drug, tetracycline. And then lastly, we can be able to modify the ribosomal unit. Modify the binding site on the ribosomal unit. The binding site on the ribosomal unit. That's important. Now, that is that for the major resistance. Now, what about adverse effects? For adverse effects of this drug, what are things I want to say here? Number one, this drug, because it interferes with deposition of calcium on probably the bone, because calcium deposits on the bone, and you know that it chelates ions. So you can tell, number one, it should have an effect on the teeth and the bone. So it will cause teeth discoloration, and it will cause some bone marrow suppression. So it has some effects on the bone. Okay, number two, this drug also causes hypersensitivity reaction. Hypersensitivity reaction. Number three, this drug, tetracycline, is one of those drugs that we remember to have some effect on the kidney, nephrotoxicity. Okay? Tetracycline also causes photosensitivity. So the person has some sunburns. Tetracycline also has some effect on the kidney. So hepatomegaly, that's the kidney increases its size and a whole lot. For the GIT, you will tell me that it will cause things like nausea, things like vomiting, all right, things like diarrhea, etc. Okay. Now, what are the therapeutic uses of tetracycline? What have we used tetracycline for? for the uses. Number one of the uses for atypical microbacteria. It has been used for atypical microbacteria, but atypical do not follow the usual gram staining. Those bacteria that will not follow the usual gram staining, you have the likes of chlamydia. You have the rickettsia. You have the mycoplasma, etc. Okay? It has also been used for even the spiral sheets. Spiral sheets. A good example of the spiral sheets that's found in application is Lyme's disease. Lyme's disease. Lyme's disease is caused by Borrelia burgdorferi. That's the bacteria, and transmitted by the white-footed mouse. So those are some important things to note about its uses. All right. So far we have talked about the indications, history, structure, classify, mechanism of action, resistance, adverse effect, use, and therapeutic indication. And I really wish and hope that you find this resource worth noting. Okay, and valuable. So please endeavor to like if you have watched to this point, subscribe, share this video, and leave a comments in the comment section. I'll be most grateful and glad to see your comments there. Do have a nice time. Until next, bye.